cases, some patients have had serious, even fatal reactions to it. CNN medical correspondent Meg Terrell has the story.
12-year-old Emmy is recovering after spending more than 3 months in the hospital.
I think the hardest part is missing out on stuff you can't do because you're here.
It all started when she was prescribed 2 courses of the powerful antibiotic best known as Bactrim to treat cystic acne. One of the World Health Organization's essential medicines, Bactrim is commonly prescribed for a range of conditions, from drug-resistant bacteria to UTIs and gastrointestinal infections. But researchers have begun looking at some rare cases in which young patients have had severe reactions that landed them on life support. Some have needed lung transplants and some have died.
Praying every day.
The medical detective work to uncover the link to Bactrim started in 2018. CNN published a story about Zay, a 16-year-old with a mystery illness that caused her lungs to fail.
Because of that article, we received additional patients and families who shared a story that was very similar to Zay's. And at that time, I contacted my friend and colleague, Dr. Goldman, who I knew had been doing Bactrim research for years. And I said, could these cases be related?
Zay ultimately died from the reaction. Doctors Jenna Miller and Jennifer Goldman diagnosed hers as the first ever reported case of Bactrim-associated lung failure. And they successfully lobbied the FDA to add a warning to the drug's label that severe pulmonary adverse reactions can occur within days to weeks.
They put me on another next set of Bactrim. And then maybe the next couple of days I started running a fever. From after that point of going to the ER the second time, that's about where my memory stops.
We thought we lost her.
It's not yet clear exactly why Bactrim causes these rare reactions in some patients, but Miller and Goldman are continuing to investigate. They and others have identified a genetic marker that all of the patients they tested have in common, and they're looking for more cases so they can learn more about the link.
20 to 30% of us walking around have that genetic marker. So although we know that's a first step needed to develop this reaction, we need to better understand other genetic risks.
They're hopeful that with more research, they can identify additional triggers or factors leading to the reaction and develop a test that could be given before doctors prescribe the drug.
If we could develop a quick kind of point of care test to say, hey, you actually have this marker that you shouldn't be taking it, that would be the ideal.
They emphasize Bactrim is an important medication, and they want to spread awareness of this rare reaction so doctors and patients know if they should stop taking it and seek care if they develop respiratory symptoms. It's a low risk, they say, of a serious reaction.
They could change.